Menkes disease is an X-linked recessive disorder of affected individuals' intestines are unable to absorb copper, and that leads to a copper deficiency. X-linked recessive disorders are mutations inherited on the X chromosome of a gene. Females have 2 X chromosomes, and males have 1 X chromosome and 1 Y chromosome. Since this disorder is X-linked, the mother passes on this genetic disorder to her offspring. It often affects young children and males. Some symptoms that they may have are kinky hair, pale pigmented skin color, weak brittle bones, and seizures. Currently, there is no cure for Menkes disease, and if left untreated, children may die from this illness. Early testing can be done on pregnant mothers to determine if the baby will inhibit the disease. The mutation for Menkes disease is found on the ATP7A gene. ATP7A helps with copper transport throughout the body. The structure of ATP7A includes many copper enzymes, proteins, 3 domains that are responsible for the energy of the enzymes, and 6 metal binding sites, which helps this gene function within the body. Humans must maintain a certain level of copper in their bodies in order to allow certain organs to continue to function properly. Humans typically get between 1 to 2 milligrams of copper a day through their diet. Copper is stored in the liver and delivered to the rest of the bloodstream. Copper is essential to brain development, and often Menkes disease patients suffer from symptoms of neurological disorders. Recently, there have been several studies done on Menkes disease patients and neurological disorders. A 20-month-old male patient had lower copper levels in the cerebrospinal fluid, and he suffered from late neural development. In order to figure this out, doctors had to run several blood tests and MRIs. The reason that this patient has such low copper levels found near his brain because of a mutation in proline 1001. Proline 1001 helps recognize certain metals and movement across membranes. Other researchers speculate that receptors in the brain or signals in the brain called MDA correlates with the ATP7A to transmit copper to the brain. If the receptor is either turned off or not connected to ATP7A, this may lead to neurological problems. Researchers are now looking into ways to treat Menkes disease. The technological developments that have helped widen our knowledge about how Menkes disease works are fluorescent probes, PET scans. The fluorescent probes use the relationship between wavelength and intensity of copper ions such as copper 1 and copper 2. This tells us how specifically copper transmits to the brain. The PET scans analyze how the copper levels distribute throughout the brain and kidneys for mice models that have Menkes disease. These technologies set the precedent for more research on how the ATP7A gene functions or how copper levels function within the body. Currently, there are various treatments out there for Menkes disease. Some of those treatments is copper injections given to the infant, and is more effective when the disease is diagnosed earlier on. Researchers are now working on injecting functional ATP7A genes into the brain, and they use mice to model the effectiveness of this treatment.
Created using Powtoon.